Gorham-Stout disease, also known as disappearing bone disease, causes bones to dissolve into connective tissue. The first documented report occurred in 1838 when an article titled "The Boneless Arm" was published in the Boston Medical and Surgical Journal. The article was centered around an 18-year-old patient that had fractured his arm. The patient then refractured his arm twice, preventing the arm from healing properly. After visits to the doctor, he discovered that the humerus bone had apparently disappeared, even though the patient could still move his arm. Doctors Gorham and Stout were the first physicians to formally present the disease to the American Association of Physicians, making Gorham-Stout disease documented.
Gorham-Stout disease is an extremely rare bone disease. It is characterized by bone loss and overgrowth of the lymphatic system, but the cause for it is unknown. As lymphatic vessels spread, bone breaks down and is replaced by fibrous connective tissue. Some commonly affected areas are the ribs, spine, pelvis, skull, clavicle, and jaw. Gorham-Stout disease affects everyone differently depending on the severity of the case. In more mild cases, it is possible to live a semi-normal life. Even in extreme cases, treatments are available to improve quality of life. However, cases involving the thoracic cage and spine can lead to more severe or life-threatening outcomes like paralysis or heart conditions. Overall, those affected by Gorham-Stout may experience swelling, pain, and weakness of the affected site.
Hearing your own bones crack and break. That's exactly what happened to one woman with a very rare vanishing bone disease with no known cure. WRAL's Dr. Alan Mass tells us about her amazing fight for survival.
She's painfully thin and moves with the stiffness of someone whose neck has been fused to her spine. But Laurie Harms is grateful to be alive.
There's moments that, God, I can't imagine not have been here before.
The 31-year-old mother has an incurable rare disease called Gorham-Stout syndrome.
It's otherwise known as vanishing bone disease, and does exactly what it says. I mean, my bones have basically vanished in my neck, and
her symptoms started in her teens, but even on her wedding day, she still looked healthy. After the birth of her daughter Sky, the bones in her neck deteriorated so that she couldn't hold up her head.
I had a trach. I couldn't talk.
After being rushed to another hospital in Los Angeles, doctors basically gave up. She would go home with a broken neck and a tracheotomy. She may have died until a spinal surgeon stepped in. Dr. Frank Acosta rebuilt her neck and spine.
For short-term future, I think I'm cautiously optimistic.
But since most people with Gorham-Stouts only live into their 20s, her long-term future is uncertain.
When she came out of her first surgery, they gave her 2 years to live, and now it's been, almost 8 years.
And Laurie Harms continues to defy the odds. Dr. Alan Mass, WRAL Health Team.
This is how rare it is. So far, only 200 cases of Gorham-Stout syndrome have been documented worldwide.
Right now, doctors don't know what the best way is to treat Gorham-Stout disease. Treatment is varied for each individual based on their symptoms. In some cases, surgery is needed to remove the affected bone. In others, bone grafts are used as reinforcement to existing bone. Some physicians even use an artificial bone to replace a removed bone. Radiation therapy is sometimes used to prevent the spread of the disease. There's a lot we don't know about Gorham-Stout disease, but research is being done to further our understanding. Some patients are receiving new treatments in the form of medication that promotes bone regeneration. Currently, clinical trials with larger amounts of patients are needed to find an effective dose. Along with bone grafts, artificial bones, and radiation, researchers continue to look for alternative treatment options.